Background information about major depression. Diagnostic criteria: depressed mood most of the day, diminished interest in most activities, significant weight loss or weight gain, slowing down of the thought and physical movement, fatigue or loss of energy, feelings of worthlessness and excessive guilt, and recurring thoughts of death.
I need dinner.
Hey. Oh, sorry, I can't hang out tonight. Yeah, I got some things to do. Yeah, I'll tell you tomorrow.
Major depression is one of the most common mental disorders in the United States. 16.2 million U.S. adults have had at least one major depressive episode. Specific cultures and genders. Women are more likely to have depression than men in the United States because of postpartum depression. In the U.S., whites are more likely to have severe depression that lasts about 2 weeks, while African Americans and Mexican Americans have milder depression that lasts longer. U.S. adults between the ages of 18 to 25 most likely to suffer depression in the 2016.
Theories of cause. Brain scans of deceased depressed patients showed that the frontal lobe displayed lower activity levels than those of non-depressed patients. Genetics. Study of twins showed that if one twin developed depression, the other twin was 40% more likely to develop it also. 20% in fraternal twins. Environmental. Studies have shown people who suffer traumatic events or unhealthy behaviors like abusing drugs, alcohol, or poor diets are more likely to have depression. Associated features of depression: anxiety, restlessness, agitation, unexplained physical problems such as back pains or headaches, trouble thinking or staying concentrated.
Brief history of humanistic therapy. Humanistic therapy started in the late 1950s when Abraham Maslow and a group of psychologists met to discuss a more human approach to psychology. Carl Rogers is credited with the discovery of humanistic therapy when he published Humanistic Psychology and Therapy in 1951. It is still a very popular type of therapy today. General approach. Humanistic therapy focuses on an individual's nature instead of categorizing a group of people with the same problems. Emphasis is on a person's positive traits and the ability to use their personal instincts to find wisdom, growth, healing, and fulfillment within themselves. Specific approach to depression. Therapist goals to make the patient self-actualize and realize they are not worthless and have a life worth living. The therapist has to be non-judgmental and make the depressed patient feel good and comfortable with him or herself. After each session, the patient should feel like the therapist supports them and feels like a friend that he or she can rely on. After numerous sessions, the patient and his peers should see significant positive changes in his or her behavior and mood. Humanist therapists would probably not prescribe antidepressant drugs like Zoloft, Prozac, or Celexa unless the patient is very severe in depression or they are not seeing much growth after treatment. Case study: Brendan, a single 25-year-old, was recently diagnosed with major depressive disorder. He suffered symptoms of depressed mood nearly every day, weight loss, loss of appetite, insomnia, diminished interest in most activities, and sometimes thoughts of inflicting harm on himself. His therapist set up a 5-session per week program, 90 total, in hopes of curing his depression. After the 90 sessions were over, Brendan's family reported that most of his symptoms were non-existent, and he seemed to be himself again. We will look into one of the sessions between Brendan and his therapist right now.
So Brennan, how's your day been so far?
I mean, it's been okay. I've just been doing the same old stuff. Been going to work and coming back home.
How about your sleep last night?
I got a good amount of sleep.
How many hours?
I'd say about 5 hours.
Just keep trying to get up to that 8-hour sleep schedule. How do you think your energy was at work, like with your coworkers?
I mean, it's been getting better lately. I've been talking a little more.
Did you eat today?
Yeah, I actually ate half of a sandwich at work.
Any trouble like concentrating, like during work?
Yeah, just a little bit. I've been having some recurrent thoughts.
Harmful thoughts?
Yeah, they've been pretty harmful.
Just make sure you don't go too low. Just keep on trying to think positive. When you ask my friends, do you like go out or do you just like stay home still?
I usually stay at home.
Ever thought of like trying to go out?
Not really.
I mean, you can just try it. Like, I say one time, you gotta at least try.
Yeah, I get it.
This is a good session. You just gotta keep working on improving. Hey man, it'll get better.